So, hi ma'am, good day. My name is Eirene GAPATE from NR11 Group 2, and today I am going to demonstrate the procedures in bed shampooing. So, the purpose of providing hair care to the patient is to stimulate the blood circulation to the scalp, distribute hair oils, and provide a healthy sheen. Assess or monitor any hair or scalp problems, and of course, increase the patient's comfort. Now, for the assessment, check the chart for information related to the patient's ability to participate in the procedure. This could prevent me from inadvertently forcing the patient to move if he ever has a problem on his head, neck, back, or spine area. Now, assess the patient for specific symptoms like scalp flaking, itching, lesions, neck pain, or anything that may affect the shampooing procedure. Now, check to see what supplies or equipment are already in the room to avoid having too much supplies or equipment more than necessary. Now, for the planning, determine assistance needed to make it easier for me and to the patient to do the procedure. If the patient has a mobility problem, I can ask his relatives to participate also just to have an additional assistance. Then determine what supplies and equipments are needed, because organizing and gathering necessary equipment prior to entering the room saves a lot of time. Then perform hand hygiene. So earlier I have already washed my hands. This is to prevent the transmission of harmful pathogens and protect the patient from contacting infections. Then lastly, obtain the needed supplies such as the pitcher with a clean and warm water, shampoo basin or Kelly pad, a basin or a pail receptacles, plastic sheet, the shampoo itself, the washcloths, bath blanket, bath towels, and of course, the comb or hairbrush. For the implementation, identify the patient and explain the procedure. It is an effective communication skills that is essential to establish rapport. It also facilitates the patient's participation and cooperation with the procedure, and of course, it reduces anxiety. Then, provide privacy because hygiene is a personal matter. If possible, raise the bed to appropriate working level to make it easier to do the procedures while at the same time maintaining patient's comfort. To shampoo the hair, remove top linens and place bath blanket to provide warmth to the patient. Place a plastic square under patient's head and shoulder. This prevents the bedsheet from being soiled. Then, remove the pillow from under the client's head and place it under the client's shoulder unless there is an underlying condition. Place towel around patient's shoulder and neck because the towel collects any removed hair, dirt, and scaly materials. Place the shampoo basin or kelly pad under the head and put a washcloth on the edge of the basin where the patient's neck will rest. Arrange a trough or receptacle under the patient's head. Insert the spout of the shampoo basin inside the receptacle to effectively collect shampoo water. Place a damp cloth or washcloth over the patient's eyes to protect it from possible water splash that could irritate their eyes and make the patient uncomfortable. Place cotton balls in the patient's ears if indicated. Wet the hair with water, taking care to keep water out of the patient's eyes. Then, shampoo using only a small amount while massaging the scalp with pads of your fingers. Then, rinse twice thoroughly. Assist the patient to comb or brush and arrange their hair. This will help loosen any tangles. Now, remove equipment, then replace top linen, then remove the bath blanket. Allow the patient to rest. Then, watch for adverse responses and care for the equipments and supplies to prepare for the next procedure. Then, perform hand hygiene. Now, for the evaluation, evaluate using the following criteria such as fatigue, feelings about comfort and cleanliness, objective signs of cleanliness, then document as appropriate according to the facility.